43 times since we went on the air this morning. 9:47. Let's go into the K-Wave News Zoom room where we have just breaking in here with our update before we let you guys go for the weekend. Hospital Administrator Lillian Posadas. Lillian, it's like every day this week the hospitalizations have continued to rise. So
Yes.
if you could just give us the COVID census for GMH.
Okay, in the house, we have 65 individuals that are hospitalized because of the COVID infection. And of the 65, 16 of them are considered ICU level of care. And of the 16, 6 of them are on ventilator support. So yes, the numbers keep rising. And so really, it just really, makes us more we need to be really more vigilant and just really be, exercising the precautionary measures as much as possible. So yeah, the numbers are rising.
How many are at the SIF?
The SIF right now, there are 9. We have transferred a total of probably 36 individuals from this acute facility with a COVID infection. And of the 30 some, most of them have been discharged home or been discharged to the ISOFAC. So, there is a good sign there. There is that hope that people, can recover from this condition.
Okay.
And so there are 9 still at the SIF.
And all the nurses that were scheduled to arrive yesterday, they all here?
Yes, 4 of them arrived the night before, the 21st. 3 arrived on Sunday. So we've got 7 additional ICU registered nurses on board.
Lillian, did you see anything about that FDA approval of remdesivir for treating the coronavirus? Has that hit the island yet, or are we still figuring that out?
No, we have. We have been administering remdesivir. It's been several months that we have been receiving treatment, and the doctors have been using it, on the patients.
What's the morale of the staff like? Have we had any more catch the virus?
We do have. We had a couple of new employees that through the pre-employment onboarding process, they tested positive, so we can't get them started. And so, yes, and then we have also some who are not really in direct contact with the patients with the COVID, and so they're catching it from home, from the community. And yes, the total numbers now in terms of hospital staff who have tested positive since the second wave, we are at 70. Out of the 70, 5 of them are out on isolation still. The others have recovered and are back to work.
Mm-hmm. Lillian, I know it's kind of fluid with COVID patients going in and going out and moving to the SIF, but what is the maximum amount of COVID patients you guys can hold or hospitalize at GMH?
I need to go back to the numbers again. In the Care 1, we can accommodate 6 individuals in there. In Care 2, we can accommodate 4 ICU patients in there. Right now, we had to clear it out because the facilities and maintenance people are working on some of the electrical situations. So we're gonna start utilizing that again. So that's an addition. That's 4 ICU beds that we can accommodate COVID patients who are at the ICU level of care. In the Care 3, which is the 4th floor pediatrics, we can accommodate 20 individuals in that on that floor. And then in Care 4, which is our former telemetry unit, we can accommodate 24 individuals in there. And then in the Care 5, which is our actual ICU CCU unit, we converted that to just full COVID. We can accommodate up to 12 patients in that area. We're looking to convert one of the regular medical surgical units, either the 3rd floor or the 4th floor. That's our surgical floor. That has about 33 about 33, 38 beds that we're looking to convert to COVID, strictly COVID. And so, these are all ongoing discussions that, we're looking to see how we can best utilize and restructure our facility so we can continue to accommodate individuals who need to be in the hospital because of this COVID infection.
Are there more COVID patients at GMH than non-COVID patients?
No, the combination of non-COVID, we have about 90, hold on a second. We have 94 non-COVID patients and 65 COVID patients. So that's our total census right now.
We've seen increases in children that have been infected with the coronavirus. I think 13 in between Wednesday and Thursday. How many children within this age group from 9 to 19 are hospitalized at GMH?
In the pediatrics area that are non-COVID, we have a total of 7 patients in that area. 7 pediatric patients who are non-COVID. We do have a couple of infants in the, actually only one. We have one infant in the COVID care unit.
So pediatrics, when you say there's only one, is that's everything, including the newborns?
There's some static in that. I didn't catch all your question there, Sabrina.
You said there were 7 non-COVID in pediatrics?
There are 7 non-COVID in the pediatrics unit, yes.
So there's one in pediatrics.
In the COVID, separate from the pediatric, but separate from the regular non-COVID, we have one pediatric patient in the COVID area that we're managing.
Is this the 10-month-old?
Yes, ma'am. Okay. Under 1 year.
Okay.
Lillian, anything in closing before we head into this weekend?
Well, again, just to continue to reiterate the precautionary measures, the practice, the lifestyle, the way we live is to wear the mask all the time as much as possible, minimize, congregating, and even with small family gatherings, still need to exercise the precautions because, we're seeing that some of those individuals are catching and transmitting the COVID in small family gatherings. So, please, again, continue to exercise the precautionary measures as much as possible. So social distancing, because this is our reality, is our numbers, right. And this infection is out there.
Thank you, Lillian. Be safe.
Yes, you too. Yeah. We still have the virtual empanada?
We actually have virtual risketti this morning, and there's some virtual bread from the Hotnu Bakery.
Yeah, I made it, Auntie Lillian.
Yeah.
All right, then I should come over there and get some.
Yeah, it's extra dry.
Yeah.
All right.
Try Jason's risketti, okay?
All right.
If you have any spills there at the hospital, you can use the risketti to soak up the. Thank you, Lillian.
Alrighty.
Okay, goodbye.
Bye.
There you go. Our medical frontliners also defeated this morning because you guys don't know how to listen. 9:56. Let's keep it in the Zoom room where I already told my